So thank you for being here. I want to thank KC for organizing this. My name is Roger Royce. I'm the founder of the Royce Law Firm. We're a business, corporate, and tax law firm that services technology startups. And of course, health tech is one of our big initiatives. This is the first of a series of events that we're going to be hosting for Pitch Global throughout the year on health tech. Now, I know that not everybody is here yet, but I'd like to get a sense as to who's in the audience. How many tech startup entrepreneurs? My God, almost everybody. Any product people, you know, from bigger companies, from industry? Okay, a few. Well, okay, or smaller companies. Product people, all right. Investors, VCs? A few of them, okay. I know more are on the way for our later panels. Well, we are really excited and pleased today to be able to welcome Professor Thomas Sudhof to speak with us, to do a little bit of a fireside chat. And we don't have a lot of time. I've got a few things I want to get across, and I'm going to open it up to a few questions from the audience. But for those of you who don't know, Thomas is a biochemist. He's known most for his study of synaptic transmission. He's a professor in the School of Medicine in the Department of Molecular and Cellular Physiology, and also in neurology and psychiatry and behavioral sciences at Stanford University. And of course, he is the 2013 Nobel Prize in Physiology or Medicine Laureate. Thank you. Prior to that, Thomas worked on a project to describe the role of, you'll understand this more than I do because you're all health tech people, the role of the LDL receptor in cholesterol metabolism, you know, the statin drugs. So that was based on some fundamental research that Thomas worked on for two gentlemen who were awarded the Nobel Prize in Physiology or Medicine in 1985. So he's been at it a long time. Thomas has been at Stanford University since 2008, where, as I said, he's a professor in various departments. And he's credited with discovering so many things. I mean, I printed it out, but I can't read all of the things, all of his accomplishments. But like I say, probably what he's most well known for is brain science, you know, synapse formation. So with that, Dr. Sudhof, I think I would like to just ask you maybe to describe a little bit in layman's terms for me what it is that you did to be awarded the Nobel Prize.
I am originally a biochemist, but as science has developed over the last decades, we all have become interdisciplinary. So I wouldn't describe myself as a biochemist or physiologist or whatever you want. It sort of fits. And that is also reflected by the fact that I am a member of so many different departments. I'm even a professor of neurosurgery, although I have blissfully never seen a patient in a OR, at least in a neurosurgeon OR. Anyway, my work originally focused on how one nerve cell sends a signal to another nerve cell during synaptic transmission. And that was the work that was honored by the Nobel Prize. And that work tried to understand how it is possible for a nerve cell to send a fast signal very precisely in a very, very short time. That was a mystery in many ways before we started, because everyone knew that synapses transmit information within a few milliseconds. And everyone knew that that occurred because the chemical transmitter was being used as the signal. Since then, our work has shifted. We now work on trying to understand better how the brain is wired, how it is possible for many, many synapses to form in the correct space and time, and how they change during synaptic plasticity. And We also work intensely on trying to understand what happens in diseases that affect those processes. Diseases such as neuropsychiatric disorders and neurodegenerative disorders. And that, in a nutshell, is my academic work that I'm performing in my lab at Stanford. In addition to directing a lab, I'm very interested in drug development at a number of levels. And I'm working with a number of companies, mostly in an advisory role. One of the most depressing things about drug development, at least as far as the brain is concerned, over the last decades has been the lack of success in trying to combat neurodegenerative diseases, Alzheimer's, Parkinson's, ALS, Huntington's. And I think that this is now beginning to change. But it took, for those diseases for which there finally is progress, let's say Huntington's, it really took a huge investment in fundamental research in order to achieve that. Only recently has there been appreciation that it is not just A beta that creates the disease, although I feel that we need to have a very, very general perspective that includes not only neurons, but also not only microglia, but that really includes an interaction between different types of cells in the brain and their dysfunction in order to understand, because despite the recent progress, especially in genetics, we still don't understand the disease, or for that matter, I don't think we understand any neurodegenerative disease.
To ask you to tell us a little bit about the future, especially the future of drugs. What sorts of drugs that you think companies will be developing? Will it be biologics, small molecule? For the future, what are the opportunities here for our group of entrepreneurs? What's your opinion?
I feel almost like we are now beyond the apex, beyond the climax of the biologics as an approach, certainly in disorders of the brain, but possibly even in cancer. And to me, it seems clear that the most exciting opportunities lie in manipulations that affect gene expression, RNA therapeutics, DNA therapeutics, gene therapy of one kind or another. I think that the approaches that companies like Ionis or Animam have pioneered are incredibly promising, although the clinical trials still need to be done.
And I've been reading some of the things you've been posting, the Washington Post article, for example, and some of your other articles. And I wonder, does this signal a shift in your writing? Can we expect from you more accessible explanations of the science and the brain and what you do? Or do you think you'll spend your career more focusing on the research that you're doing at Stanford?
I would hope to do both, because it is actually very hard for scientists like me to explain what we are trying to say in a way that other people understand us, especially the public. And I think that academic scientists have made a major mistake in the United States for sure, but also worldwide, in not paying more attention to communicating to the public. Talking about societal burdens, however, disorders of the brain are at least as burdensome, both economically and in terms of personal suffering, as are disorders like cancer. With cancer, finally there is progress, I think. I have the impression, and although the majority of cancers still cannot be treated adequately, at least a minority can now be treated in a way that gives rise to hope. And that after all this investment. So I think we need to really communicate to the public that although there are opportunities of translating neuroscience research, those opportunities are still small because the progress in trying to understand the diseases of the brain has been very little.
From a product. So what about that, Tom? How pricing kind of plays into all of this, and does it affect how much money actually goes into the research, I guess, is a follow-up to your question.
I think there needs to be a balance. The balance needs to be between having a reasonable price for innovative medicines that change patients' lives and that required a huge investment to develop, and I believe that those innovative medicines deserve a high price. But I also think that once the medicines are no longer innovative, once they've been on the market for decades, then there should be a process that ensures that generics actually are generally accessible to the population. The other half of the bargain, that in future, those medicines become more affordable for people, is also kept. Obviously, a very beneficial effect on performance by physical activity, there's no question. So I would never doubt the fact that there is a constant exchange of information, if you want to call it this, or of, in German the word is Wechselwirkung, since you have a German accent. There's a constant exchange back and forth between all parts of the body, and that includes the immune system as well. That includes, for example, diseases like Alzheimer's disease, where for sure it's not just neurons that go basically kaput, that break down, but it's fundamentally a disease of the body. So I do believe that in brain science we have to consider how the body feeds back onto the brain, and that I don't think there's anything magical about this. I think there's physical mechanisms that mediate those processes instead of being too stringent, because I feel that we need to have drugs that people can trust and not drugs that may or may not work. And so I'm personally not overcritical of the FDA.
So the question is, what is Tom's view on the usefulness of technologies that allow real-time, I guess, observation and imaging? Okay.
Well, it depends on the question, but for example, you could easily imagine that for screening, they're going to be very, very useful. Technology is changing neuroscience very rapidly, and there's many different types of technologies that are new. We live in a completely different era. Most neuroscientists think about things like optogenetics. I'm not sure that that's very useful, but I think what's incredibly useful is cryo-EM, which has changed how we see molecules. It's have a deep impact on biotech. Although, in the end, what's really important is having a good disease model, a good question, something to grab onto. Yeah. It's a requirement now, so it's not a problem anymore. The problem is more ingrained in small trials that are performed by universities and hospitals and that are sometimes not transparently handled. Of course, you're absolutely right. There has to be absolute transparency. Every clinical trial needs to be registered and needs to be reported. There's no question about it. Otherwise, it's lost.
You're talking to somebody who really knows what they're talking about when they're willing to admit that they don't know. So with that, I want to thank you for being here. We really appreciate you coming all the way up here on a rainy day. I want to thank you, our audience. KC runs a tight ship, so we're going to stay on schedule here, and Tom has to get back down to Stanford. So with that, thank you again, and I'm going to hand this back to you, KC.
Fantastic. Thank you so much. Now we are going to have three people, three of our sponsors, first starting with the venue host, and then two others. They are going to briefly explain the higher consciousness you will get when you are part of their ecosystem.
Delegations from Asia, Europe, Africa, Central and South America, and beyond. And really, that's what's setting us apart. We're creating a diversity-centric, inclusive community that's not just about startups and investors. This is really about the community of San Francisco. So we also do a lot with music, arts, fashion, and sort of bringing in some of the less common verticals in the startup ecosystem. We're also really trying to build a bridge to unique ecosystems globally as a way to connect startups and help boost their growth, connect them with like-minded investors.
And affordable, and there's no coagulation, there's no bleeding. It's changing the way these surgeons are doing medicine right now. We targeted 3 different areas. The one area right now where we targeted was benign prostate hyperplasia, which is just a growth in the prostate, which happens to all men. If you live long enough, you'll have this condition. So 60% of men over the age of 60 have it, 70% over 70. It's not cancer, it's just something that has to be treated. In terms of female incontinence, we've developed a laser that we can treat you in 5 minutes, no anesthetic. So here we're solving a problem right there. And in bladder and kidney stones, we've developed a new laser. All of these have single-use fiber optics. And this laser we can treat in the upper kidney, a kidney stone, without having any incisions in the body. So we're making dynamic shifts in how we treat medicine, saving money, and making people's lives a lot better. Okay, thank you.
That we have here as a community. So for this event that Casey is doing with Pitch Global, I really think this is a unique opportunity to talk to one another, to exchange ideas, and to help one another. I think that's kind of the basic, that's our strengths, that we should always keep in mind.
Versus M&A acquisition by big medical companies. So if we start with IPOs, IPOs cannot be considered actually as exit strategy. IPO is not an exit event. IPO is a financing event. And companies go public to raise money for their activities, for their clinical programs.
They said, forget every single term sheet that was in the play, every single investment round that was in the play. This is what we want. You give 50% of the acquisition capital to the employees, otherwise we don't acquire you. End of discussion. You either accept the terms or not. So all the 2x, 3x, you had a choice. And I told actually all the investors, I was on the board of directors, you have a choice. You either put $120 million into the company to further the development of what they're doing, or you sell to Intel and you will have a 1.1x.
Devices. So I know the creator of LiveStraw, right? So if you buy LiveStraw from the US, it costs you a lot more than what he's selling in Africa. So I mean, that's another differentiating factor that you can do, is depending on the address of the buyer, have a price differential.
Like $30 billion a year. And there are private foundations, there are grants at the university, so you can go to so many sources to finance a project like that. And I think that's the right thing to do, because you cannot go to private investors with an idea, because you at least need to have a proof of concept.
What they're investing, what stage they invest in, and get clarification before you go in and doing pitches and spending time prepping and going all over the valley to meet with people. For us, we're usually closer to either commercialization stage or approaching into phase 1 trials before we're really getting excited about a device or a drug or what have you. So understanding that, so you're not wasting time and resources.
And so if you're doing anything with life sciences or FDA approval, you're more of a stepwise function, so the rule doesn't quite apply to you. The way I would think about it is laying out a plan of what metrics do you need to hit to get the next round. And so I've sort of tried to, I've I know this problem, so I've tried to solve it for my portfolio companies. And the way of solving it is I'm stepping in as their free CFO. I'm actually telling them, from what I know from my VC network, this is what they're looking for to raise your next round. You got to hit these for me to get you money for the next round, right? And so then that's how we plan out, this is how much you need this round to get to your next metrics.
You can get access to the scientists, was the argument. You can get access to the lab space. And they have a first right to basically take the company out when the milestones are hit. What is today's vision to this?
It depends.
Well, it depends. I would say you need to be careful with that. And every time it's a business decision, sometimes it makes sense. But most of the time I find it really tricky because it limits your exits, as you correctly mentioned, and it exposes you. It exposes your IP, and you kind of merit to one company, which is not always optimal, because you can get access, if you have money, if you have venture money, you can get access to the lab space, you can get access to the talent. You don't really need that big guy.
Fantastic drug, fantastic device. It's got great potential, but if the deal isn't good, then it's something we really pulls us back.
Funded. So I still don't fully understand the question, but certainly you have a lot of flexibility if you're a multiple product company.
Talking to startup lawyers, they say that what's most important is what's not on the term sheet. And I'd like you to talk about what's not on the term sheet and what you feel is the most important things that are not on the term sheet.
Gwen, I think you know the gaps in the knowledge. So you answer it and we have to end this part.
I usually put a lot of things in the term sheet because so I'm actually not the best person to okay, so the reason why you have a term sheet, the reason why you have contracts is when things go to hell, right? And so that's why you spell everything out. Does that make sense? So if your company is growing faster than you expected, nobody's going to be bitching.
Okay, we have run out of time. Ask Roger. Roger will give you the answer after this.